scleral tunnel is a very useful technique when endothelial damage limitation is important. In this case, the microcystic corneal edema can be seen from Fuchs' endothelial dystrophy, and a decision to make a scleral tunnel as opposed to a corneal one probably saves some percentage of endothelial population. Other issues, such as using a soft shell technique with viscoelastic, also contribute to preserving the endothelial population. The scleral tunnel is begun by opening the conjunctivum. This is done with Westcott spring scissors, using a small radial incision and a peritomy around the limbus. Having achieved hemostasis, a 15-degree blade is used to make a scleral crescent, and some surgeons prefer to use an inverted smiley or frown incision, as shown here. This ensures minimally induced astigmatism. Again, hemostasis is achieved, and then a bevel-up crescent blade is used to create a scleral pocket. This is a pocket much in the same way as a trouser pocket, being parallel to the surface of the eye. The crescent blade is held flat against the sclera and is moved in the fashion of a windscreen wiper to gently dissect forwards into the scleral layers and forwards towards the cornea. Once the pocket has reached into the corneal tissue, it is ensured that the edges are straight and that it is approximately square. It is sensible at this stage not to grasp the lip of the wound with the left hand forceps, as it can tear quite easily. Once the pocket is created, a slit knife, which is matched to the size of the phacoprobe irrigation sleeve, is inserted into the pocket, again parallel to the surface of the eye. A side port can be made initially before the globe is opened, whilst it is still firm. Once the tip of the slit knife is seen in the cornea, the angle of the tip is changed. The heel of the blade is lifted and the tip gently manoeuvred into the anterior chamber. Again, it must be ensured that the full width of the blade is inserted into the chamber so that the phacoprobe has an adequate width to enter the eye. These wounds will be incredibly strong and allow a nice flat trajectory of the phacoprobe onto the surface of the cataract.